Good morning, good afternoon, or good evening, wherever you may be joining us from today. My name is Miriam Naiman, a senior advisor at Nefesh B'Nefesh in the Post-Aliyah NB and Answers Department, joined together with my coworker, Sarah Narer, a pre-Aliyah advisor. We look forward to spending the next 45 minutes or so with you. So get a glass of cold drink ready, a pen and paper for questions. This is an important webinar. And as we have done several webinars together, Sarah and myself, we find that often people are very busy asking their questions, typing in their questions in the Q&A only, because that is the only place where questions will be answered, in the Q&A. But when they're so busy typing their questions, they miss the content of where their answer could be found. So please do have a listen. We've based this webinar on all of our experience, which together is over 16 years of experience covering literally thousands of Olim. And we hope that we've organized it in a way that's going to give you the information that is important to you in understanding the Israeli healthcare system. Tonight's webinar will be taped and available on our YouTube channel in the next 2 or 3 days. As you see, our coworker Josh Sussman, manager of all of our programming, has put in the chat the recent link to a webinar with Dr. Tanya Kardash on the healthcare system. Our goal today is to give you more of the planning side of your Aliyah, given the healthcare system. It's one of a 3-part series that Sarah and I do together annually. We did one a week and a half ago on community and finding community and planning for community. If you missed that and you'd like to see what that's all about, you'll find that on our YouTube station. And in another week or so, we'll be doing the one on finances. And really, again, the goal here is to help you in your planning of Aliyah, not the process of your apostilles or your application or any of the checkpoints of what you need to get here, but rather what things will look like for you once you are living here. I haven't looked at all the participants today. We do have a nice crowd expected, but I do know that some of you have written to me after last week's webinar, and I've been on vacation. So your emails will be coming shortly in answer to some of those emails that you sent. We are just about ready to begin. Sarah, would you like to introduce yourself and introduce our coworker, Joey?
Yes. So I'm Sarah Narer. I work in the pre-Aliyah department of the Aliyah division of Nefesh B'Nefesh. Most of my experience has been with the senior population, with 50 plus. I include myself in that. I'm using senior in a very broad sense. We're excited that we have a chance to discuss something that is not paperwork and bureaucracy related. I'm trying to get rid of this thing at the top, but I'm not getting, that's not working. Okay. The goal for this series, like Miriam said, last week we talked about communities, choosing your community. And in 3 weeks' time after Hanukkah, we will be discussing finances. But our goal for today is to discuss healthcare. We want in this whole series to help you consider the issues surrounding living in Israel, and in order to eliminate as many unexpected surprises as we possibly can along the way. This format does not lend itself to interactive discussion. Please use the Q&A box for questions, and we hope to have time at the end to answer questions, but we may not because there is a lot of content here. You can always email either Miriam or me with additional questions. So, are we ready to start, Miriam? I think so.
I think so. Go ahead.
Okay. And as I think Miriam mentioned, last week, our colleague Tanya Kardash spoke about the healthcare system from the point of view of the medical community. She's a doctor and works with Maccabi Healthcare. We are obviously neither one of us physicians, but we have a lot of experience helping Olim with their healthcare questions, and we're going to approach this from a slightly different point of view. Let's get started. How do I choose healthcare? How does one choose it? Is it free? Should I keep my foreign insurance? Will my medications be available in Israel? Will my doctor speak English? These are some of the questions we want to try to get to today, and that we regularly get asked along the way when we are helping Olim. We're going to go, let's start with an overview of the Israeli healthcare system. It's a semi-socialized system of medicine, which is overseen by Bituach Leumi. The Bituach Leumi logo is this menorah-looking symbol at the top left with blue and white. They are the National Insurance Institute. Healthcare services, however, are directly provided by the Kupot Cholim, the health funds. There are 4 of them. Kupat Cholim is singular, Kupot Cholim is plural, and they're similar to US HMOs. The first one is Klalit. This is the one here with the green and blue logo. It is the oldest and the largest of the Kupot Cholim. Next is Maccabi with the blue swoosh and the Star of David in the middle there between the 2 letters. Mucharet has the orange logo, and Leumit, which is the smallest HMO, has the flower logo. Even if you don't read Hebrew, we're trying to remember the logos and the coloring scheme of each of these individual health funds will assist you in understanding which one you want to go with. New Olim are fully covered by Bituach Leumi from the moment that they land in Israel at a basic level that is required by law. This is true of every new Oleh. It is not necessarily true of those who have previous Israeli status, and we'll get more into the details of that in the rest of the presentation. This means that by law, every Israeli resident must be part of the system. It is not optional, it is required. It is not connected to your employment or your employer, and it is not an employment benefit as you might be used to in the United States. It is more similar to the Canadian system of healthcare, although I understand that in Canada there is no fee. In Israel there is. It is not a free system. There is a participation fee. We'll discuss the additional supplemental coverage that you can choose in addition to this basic coverage, which is enacted by law. And we'll, like I said, we'll also discuss how those who have prior Israeli status can gain access to the system. All the Kupot, all 4 of these health funds offer identical services at the basic level because, like I said, these are enacted by law, and they must cover you exactly the same way at that basic level. Where they are different is at the higher levels of coverage, the supplemental levels of coverage. Each one of them has 2 levels of coverage above and beyond the basic coverage. Not all of the Kupot Cholim, not all of the HMOs are available in every single city in Israel. Some of them have more presence in certain parts of the country, and others have more presence in other parts of the country. Part of your job as you're preparing for Aliyah is to research where you are hoping to live and which of these Kupot are the best, offer the best services for where you're planning to live. It could also mean even the neighborhood that you're planning to live. If you're going to a larger city, some parts of the city might be better represented by a certain of these Kupot, and other parts may be represented better in other parts of the city. It depends how far and how willing you are to travel to get to a doctor that can speak to which one of these you might want to join. Membership in this system, in this healthcare system, is residency-based. That means that in order to maintain coverage under this system, you must live in Israel, you must reside in Israel at least 183 days out of a 12-month period. 183 days is 6 months and a day, approximately. And this year is counted from your Aliyah date to your Aliyah date. If you arrive on January 1st, so it's a calendar year. If you arrive on June 1st, then it is from June 1st to May 31st of the following year. me.
Sarah, I just want to reiterate about the residency requirement. The residency requirement is a requirement for all Israeli citizens. It is not something that's OLES specific, nor is it just in the first year specific. We understand that there are plenty of people listening who may be leaving children or other family members back abroad. We understand that there could be people who will be making Aliyah at one time only to then go back and sell a house or tie up a business or even perhaps continue working. And all of this can be worked out, but you must keep in mind that there is a residency requirement, and that residency requirement is taken seriously. It's not like, oh, maybe, or oh, I could be flexible about it. So if long-term, or I say short-term after your Aliyah, you are not planning on being in Israel for a minimum of 6 months' time, discuss this with your pre-Aliyah advisor prior to your date of Aliyah so that you can understand the consequences or how to work within the system given the situation that you would like to sort of have merged together with your decided date of Aliyah. Thank you, Sarah.
Yes, I want to add one more point that I did not make clear, which is that 183 days is a cumulative number. It is not a consecutive number. You need not be in the country for 6 months in a row, but you do need to be in the country for 6 months out of 12 months. Bituach Leumi, the National Insurance Institute, regards women over age 62, which is also changing now slowly to eventually be 65, but right now it's still 62, and men over 67 to be retired, regardless of employment status, meaning your designation as a retiree is based on your age rather than your actual employment status. Participation requires and involves a monthly contribution. This covers a basic policy, as I stated earlier. New Olim who are unemployed are exempt from paying to this payment to Bituach Leumi for the first 6 months after they arrive. Those who are previous A1 visa holders who were temporary residents in the past in Israel, or those who are returning residents, are not eligible for this 6-month exemption of payment. If you are retired, but that basic cost, meaning if you are above 62 for a woman or 67 for a man, is 104 shekel per month currently. It does change every so often. If you are under retiree age, but are also not working, then that number is 177 shekel per month. If you are employed, then that number is based on your income, your salary or your income. It is a percentage of that income that is paid out to Bituach Leumi as part of the requirement. Even if you are working remotely in the US, but sitting in Israel, you are required to make that payment to Bituach Leumi, and it is contingent upon you to organize and arrange for that payment to be paid to Bituach Leumi on a regular basis.
I just want to clarify something, Sarah. For those who are under retiree age, this amount of 177 shekel includes the basic healthcare contribution as well as a national contribution, which is something that is an obligatory payment for all citizens until the age of retirement. What is the age of retirement? Again, you see here above, 62 for a woman and 67 for a man.
Correct. Thank you, Miriam. Women who are under the age of 62 and are not working, but their husband is working, will be included in his payments and won't have a separate payment. That's still correct, right, Miriam?
I'm sorry, I was answering a question, so I didn't hear.
Women who are under the retiree age but are not working are covered by their husband's payment to Bituach Leumi.
You are correct.
After retirement, however, the payment is individual per person and not per couple.
Correct.
Okay. Good. Let's move on. All right, let's talk about what Miriam and I have decided to call our AAA map. This is our map for the topics that we will consider today, the items that you should be thinking about as you plan your Aliyah. It's not just about how many documents I have and when do I need to send them in and how do I get approved, but it's also about thinking what it will mean to live in Israel. How will I get healthcare? How will I access it? What are the topics that I need to know that it may be different from what I'm used to? Even if they're the same, you still need to know the system that is different from what you are used to, most likely in either the US or Canada. If you're listening to us from another country, I'm going to admit that I know less about those countries and how their healthcare system works, but definitely it's important to know how the Israeli system works. It's probably at least somewhat different from what you're used to, no matter where you live. All right, our destination on this map is to get a clearer understanding of the different medical systems in Israel and like I said, how they are different from your country of origin. How and when you register for Israeli healthcare is influenced by your Aliyah status. New Olim, those who don't have any previous Israeli status, have immediate access to the system and are registered immediately at the airport. Your Aliyah advisor will be asking you in advance which of the HMOs you wish to join. This is research you need to do prior to booking your flight. And when you arrive at the airport, you will receive a document that shows that you've registered for the Kupa, for the HMO that you chose, that you told your Aliyah advisor you would like to join. If you have previous Israeli status, there is some, depending on your status, there is some registration that happens at the airport now. This is brand new news, but there's still not immediate access. It can take a couple of weeks for you to get access to the system. New Olim have access immediately. Former A1 holders, former temporary residents in Israel will register at their local Bituach Leumi office rather than at the airport, and there may very well be a longer gap in coverage. So we strongly recommend that if that is your status, you come with private coverage for this gap period, which we say can take up to 3 months. It's usually much less, but we suggest that you start with coverage for the first 3 months and then cancel it as soon as you get into the regular system. Those of you who have spouses or who are returning residents, there is a 6-month waiting period to gain access to the healthcare system, or there is a buy-in fee of 12,210. Is that still correct, Miriam? Shekel to have.
I would wait until January, but at least for now, it's still correct.
At least for now. Till January, it may change. To have more immediate access. If you want immediate access, you will pay this buy-in fee, and then you will not have a 6-month waiting period. Basic coverage, which is, as I said, for New Olim, it begins immediately, includes doctor's visits, including specialists, lab services, hospitalizations, surgeries, discounted medications, and additional treatments like physical therapy, speech therapy, occupational therapy.
And mental health. And mental health.
And mental health. Thank you. Very, very important. And mental health. Universal system. It's a universal system which is accessible to all Israeli residents, regardless of age or pre-existing condition. If you are a new Oleh, if you sign up within the first 90 days after your Aliyah for the supplemental coverage, you will maintain full eligibility for the supplemental programs without any waiting period or exemptions. It's crucial to sign up during that 90-day period in order to get full access to the supplemental programs. We strongly advise, because it is relatively, especially those used to the US system, relatively very inexpensive to join at the supplemental level. I think the highest coverage at the most expensive kupa is still under 200 shekel per person per month. Even it's by age. So as you age, it gets more expensive, but I believe that it does not ever go above 200 shekel per person per month. So we strongly recommend that you go ahead and add that supplemental coverage.
Sarah, this is a good time just to make mention that there are links for everything that we are discussing. I don't know if our coworker Joey is putting those in the chat, but they will certainly be sent to all of our participants. And one of those links included are the tables of cost for all four Kupot Cholim, for all four healthcare providers, so that you can see when we're talking about cost, what it is that we are talking about based on your age range. As Sarah mentioned, the cost for supplemental insurance is based on age, having nothing to do with pre-existing condition.
As long as you sign up in the first 90 days.
Well, regardless of when you sign up, that's what you're going to pay.
Ah, right, I see. You're right, you're correct. You're absolutely correct. Okay. Choosing Kupat Cholim, as I mentioned, pay attention to the logos and the color scheme of each of these, even if you don't read Hebrew. It's pretty easy to remember the logos. So once you make a decision which one you want, then you can remember it by its logo if you don't remember the letters and have trouble with the Hebrew. Like I said, you must choose a kupa prior to your flight. This is a requirement. You even if you do not intend, as Miriam said before, to stay in Israel, to be resident in Israel for the 183 days, in order to complete the Aliyah process at the airport, you must have a kupa listed in your file. It's up to you at a later date whether you want to pass on your eligibility by not residing in Israel long enough, but at the original Aliyah, point of Aliyah at the airport, you must have a kupa chosen. As I said earlier, research the town or the neighborhood or the city that you will be moving to and find out from friends and neighbors and relatives recommendations about as to which of these kupot are the most accessible in the place that you are planning to move. It may be that you have if you have a specific doctor that you need. For example, I spoke to somebody last week who needs a kidney doctor. This is his primary care doctor as far as he's concerned because he has a long history of kidney problems. So they are choosing based on a recommendation of a specific kidney doctor that they are going to work with when they get to Israel. But for someone else, it might be that what you are looking for is a really excellent English-speaking family doctor, general practitioner. In Israel, they're called family doctors. Then you should choose based on which of the kupot that doctor works with. It could be he or she works with more than one, but it's something that you need to find out. When you get a name of a doctor from somebody, if somebody is recommending a doctor to you, please confirm that that doctor has an open practice. Some doctors are not taking new patients, and this is important for you to know in advance if you are not going to gain access to that doctor because the practice is closed, to find a different recommendation or a different name. You can change your kupa in the first 14 days after you arrive in Israel with pretty simply and straightforwardly. The state of Israel gives you the first 2 weeks after Aliyah to change your mind if you recognize that you've made an error in your choice. After that, you can change your kupa every 2 months, up 6 times a year. There are 6 times a year where it is you are allowed to make a change. You can only do this, however, twice in a 12-month period. You must announce that you want to move your kupa 6 weeks prior to the actual date of change, just so you understand it's not something that happens from one day to the next. It requires 6 weeks of bureaucratic paperwork not on your part, but on the part of the Kupa, bureaucratic paperwork for you to move over to your new Kupa. That's not true during the first 14 days. Then you have, it's like an open enrollment during those 14 days. You can switch at the same level of coverage. So for example, if you join Maccabi at the highest level, which is called Shali, Maccabi Shali, you can switch to Meuchedet C, which is their highest level, without repercussion. You're covered exactly at the same level of coverage from your old Kupa to your new Kupa. If you want to change and go up a level, then there might be waiting periods. There will be waiting periods for that additional service. Why might you want to switch? You're moving communities, and the community you're moving to doesn't have good representation of that Kupa. You have a change in your healthcare needs, and you want to change to a new doctor. But also, as Miriam noted, the service is at a national level, not just a local level. So if you're not happy, if you're discontent with your doctor, it may not require changing doctors. It may require changing doctors. You might want to change your doctor, but it may not require changing the health fund. You might want to search out if there is an alternate doctor that you could have access to in that health fund without changing your health fund. Most doctors in Israel speak some English, but not all are fluent. So, or even native speakers. So if that is important to you, that is also something you should be asking when you're deciding what doctor to register as your primary care doctor. Also remember that the office staff might, even if the doctor is a native English speaker, his office staff may not speak English. The apps, the phone apps for each of these health funds are not represented in English at all that I'm aware of. So if you want to use the app, you may have to have a little primer from somebody to help you. They're actually pretty easy to use, but if you're not fluent in Hebrew, or even if you don't read Hebrew, it may be difficult. So having somebody sit with you and teach you what each of the options are on the app might be something that you will need initially.
Sarah, before we go on to the next slide, because I don't want our time to run away from us, I would like to just recap a couple of things that Sarah has mentioned, mostly focusing on choosing a Kupat Cholim and feeling that you have control over navigating your healthcare once you are here, because very often, regardless of how much planning and how much research you do prior to Aliyah, living and having to make that first doctor's appointment or filling the first prescription, or the tachlis, the real hardcore day-to-day life of experiencing healthcare in Israel is different, but it's another step in the process. If you say the first step was just your decision to make Aliyah, and your next step is some of this research, there is also then the last step of actually experiencing and living. And no matter how many webinars we hope that you listen to and how much information we hope that you fortify yourself with, there is still that last point of experiencing. And honestly, living in Israel for 26 years, sometimes you just have a new experience and you have to learn new lingo, new doctors, and that's sometimes scary, as it would be in your country of origin today as well. And what I would really like to point out most is that is where the post-Aliyah department comes into play. So whereas Sarah mentioned that the online sites of the Kupot Cholim are in Hebrew, or using the app to find out your blood test results, or how to talk to your doctor online through email, or any of those things, they are all in Hebrew. But we have volunteers to assist you once you are here. We have my team, the post-Aliyah team, to assist you in navigating some of these things until you get, quote, the hang of it, until you get enough experience to know, okay, this is what I'm looking for. And sometimes, you could say trial by error if you pick up cottage cheese instead of sour cream, but certainly when it comes to your healthcare, that's not where you're going to want to experience a trial and error. And Certainly, we understand that because we have the same experiences. Let's go ahead, Sarah.
Okay, so I'm going to go quickly through this slide because we're quickly running out of time, but I'm going to let Miriam take over from here and share with us her immense knowledge on all of these additional topics.
Right. So there was a question in the chat, and again, I'm just going to put a plug in. Any of your questions, please put in the Q&A. Is if retirees have access to supplemental insurance. And one of the wonderful things about Israel is that it's a country that very much respects its elders, very, very much so. And when it comes to healthcare, as Sarah mentioned, it is a government-based benefit for all Israeli citizens. And so, regardless of your age, my oldest Oled was 102, but I know Sarah had somebody 104. Regardless of age, regardless of any pre-existing condition that you're coming with, you have access both to basic and the highest level of supplemental care. All four Kupot Cholim, healthcare providers, have two levels of supplemental care. Why would you need both levels? The first level very much broadens what you have access to in the basic. As Sarah mentioned, the basic offers you basic care on every need, whether it's diagnostic care, therapeutic care, surgical care, general medical care, specialist care, is all covered under the basic. How it's covered under the basic will be different than the supplement. The supplement will afford you different benefits. For example, you may be able to get an appointment sooner. You may be able to, it's not may, I know, you will have different access to different specialists and choosing your own specialist or your own surgeons, whereas with the basic, you are at the hands of the government system, so that if you were told that you needed a surgery, you would just have whatever surgeon came your way in the hospital, as opposed to when you have the supplemental level, either level of supplemental insurance, you would then have access to personal choice for either a second opinion, surgical care, whatever it may be. The cost of supplemental insurance is, as Sarah mentioned, based on age. So for someone who is 20, it's not the same as for someone who is 80. But the difference in cost is not astronomical in any way. It's one of the few places that you might say you get what you pay for. The opposite, you get a tremendous amount for a relatively nominal fee of healthcare per month. Now, I can't compare it to those of you who are coming with worldwide healthcare from a federal retiree package, or for some of you who may have certain benefits available to you in your country of origin. It is not free. It's a financial participation. But if you are paying the equivalent of 25, 30 US dollars for the highest level of care that Israel has to offer on a government level, so that if you needed a surgery and a 2-week stay in the hospital and it cost you almost nothing, right, then that $25, $30 a month is an okay fee to pay. Both levels of supplements have a little bit of difference to them. The first tier broadens everything that the basic has to offer, including seeing, as I mentioned, a specialist for a second opinion, or you don't want to wait, and so you want to see that specialist more quickly, and you may end up paying 20% of that private visit, and your Kupat Cholim will pay 80% of that private visit. It affords you perhaps more visits for therapeutic care, physical therapy, occupational therapy, and such. Whereas the higher level, we'll call it a gold level, okay? The higher level of supplement will broaden that even further and may also give you certain lifestyle supplemental care. Both tiers in the supplemental level afford you dental care and optical care. It is your choice if you want to see a dentist through the Kupat Cholim clinic or not, whereas everyone will go to use the clinic setting for their medical care. There are still many who will seek out a private dentist versus clinical care through the Kupat Cholim. I don't know who's listening today or what countries you are calling from, but in the US, for example, a person may call a dentist and say, "Hi, do you take this particular insurance?" And that is not the way a private dentist will work in Israel. Any medical care you get, whether it is dental care, optical care, medical care, will all be associated with your choice of healthcare provider. When it comes to mental health, that is also covered both under the basic and the supplement. How can you compare all of the different Kupot Cholim? There is a website called call.gov.il. I believe Joey has put it in the chat. And again, this will be sent to you. Nobody needs to worry about writing anything down. And you can right click on this very wordy Hebrew website. And if you right click and translate into English, you can then compare for yourself, perhaps your diabetic needs, perhaps your mental health needs, perhaps whatever need that you may have per kupa to see how one covers over the other. What about nursing care? Nursing care has a lot of different meanings to it. All Kupot Cholim offer medical care in the home if someone is immobile based on surgery or based on a particular happening that that person cannot now get either to a nurse for a changing of a dressing or an IV of some sort or blood test, or for a doctor to come and check post-op they are still immobile. And what that takes is for the family doctors to write a prescription, a request, which cannot be denied for whatever care that might be. That might be OT, that might be PT, to come to the house until the person is well enough to then resume the same care in the clinic setting. Nursing care can also be through a carer, through a caregiver, whether that's hours of care over the course of a week, or if that is 24/6-hour care. We don't have 24/7, but rather that foreign care worker who is the worker who provides 24-hour service, not an Israeli, but a foreigner, gets 1 day off. Now, there are many different ways to get long-term care. A person can turn to the same insurance agency that's giving them car insurance and home insurance. And why do I say home insurance specifically? Because people often forget about the importance of home insurance. This isn't appropriate for here, but I'm just going to put in a plug. Because I recently did have an Ola who had an unfortunate experience, and they were going to get to their apartment insurance, their home insurance. They were renting. They didn't think about it. They moved to Israel months ago. And it's unfortunate that they didn't take care of it right away. But that same agency that offers you other insurances also may offer you long-term care insurance. It may be based or may be influenced on pre-existing conditions, and you may be denied. It also may be influenced by age. You can look at websites of different agencies such as Eggert and Cohen or Goldfuss. There are different insurance agencies in Israel that are popular amongst the Anglo public. And just have a look on their websites to see what they have to offer. Naturally, the older one is, the more a long-term care benefit is going to cost. Some of you may have a policy already that will cover you in Israel. I can't know what policy that is. That's something that you'll need to go to your agent to see if they will cover you. If that is the case, you may be able to combine that care together with something in Israel to give you even more hours of care. In addition to a private policy through an insurance agent, you can also sign on for a private policy through your Kupat Cholim. Now, whereas with the basic and supplement, age and pre-existing condition had no place for your eligibility, when it comes to long-term care, age and pre-existing condition will influence your eligibility for the 5 years of care of long-term benefit offered through the Kupat Cholim, and only 5 years. That is what that particular policy offers you. It's not really through the Kupat Cholim, but rather it's outsourced to one of the general insurance companies in the country. And so an experience I can share is a woman whose 5 years were going to be up. And that benefit was paying for her to be in a nursing care facility. And the children called and said, well, what can we do? And I said, 5 years is 5 years. What's the plan? So if you're going to use that policy, it's important to think of when you're going to use that policy. It's important sometimes to ask, can a policy can it start and be stopped and restarted based on need? Sometimes we have a need for a long-term care or a caregiver based on a replacement surgery, based on something that's shorter term and not longer term. If you don't ask, you will not be told. And that's from meeting the secretary the very first time, because, remember when you were in school and the secretary in the office was so much more important to know than anybody else because she held the key to so much information. Same holds true in a doctor's office. You want to become friends with the secretary. You want to be able to call her by her first name so that she knows who you are as well, and ask questions. So if you are applying through the Kupat Cholim for a long-term benefit, ask these questions before signing on the dotted line. The Bituach Leumi, the National Insurance Institute, also offers a long-term benefit, and that is a benefit available to all Israeli citizens. It is a government-based benefit, and it is a law. It's called an elder care law. And it is based on income, not only for you as Olim Chadashim, but also for all Israelis, because it is a socialized system. And so if you are a single person or a married person, and your worldwide base income is within the threshold that is listed on the Bituach Leumi site under elder care, and I'm happy to send that to anybody, or Sarah can, just email us privately, then you can know that you will most likely be eligible for how they assess you for hours of care. What does that mean? That means that you may get as little as 9¾ hours a week, which is almost nothing. You may decide not to get hours of care from a caregiver, but rather money offered, because there are different levels that you can request. Or you may get as many as 24 or even 27 hours for somebody who's a Holocaust survivor, and anything in between. Below the age of 90, one is assessed by a nurse from the Bituach Leumi who comes to the home, who sees the person and how they manage with their daily needs, because that is what's being assessed for the benefit of long-term care. Can they feed themselves, dress themselves? How do they carry themselves? And so forth. Some of you may be questioning about your foreign insurance. Should you keep your Medicare, Medicaid? What should you do? Should you keep any foreign insurance, regardless of where you're coming from today? Or can that foreign insurance be used in Israel, either in addition to or instead of the Kupat Cholim system? By law, all Israeli citizens, including you yourself, must be the national insurance of the Bituach Leumi, thereby part of a Kupat Cholim. If you have some sort of worldwide benefit and you know that all of your receipts and such can be submitted to your foreign policy, then get the basic, and then you can just use whatever you need based on your foreign policy, because it is worldwide. But whatever you may have used foreign insurance as a tourist, let's say Blue Cross Blue Shield, that cannot be handed in instead of a Kupat Cholim card. Some people choose to keep their foreign insurance for the first year out of security. They're just not sure what the Kupat Cholim system is about. They're just worried to cut that cord. And I really understand that, because it's a hard cord to cut. It is a security that is literally our lifeline. But most people do cut it, either because they are very comfortable with the Kupat Cholim system. They find the doctors that they like. They have trust in the doctors that they have found. And they know that if they go back and forth to wherever they are going, they'll get healthcare coverage through the Kupat Cholim. They'll get travel insurance through the Kupat Cholim, or through some other policy that they choose. But what if you're traveling and you know that you're traveling, at least for the first couple of years, for 3 or 4 months, you've left people behind, you're closing a business, for the first 3 or 4 years, and you know you're traveling for 3 or 4 months, kavua, at a set time every year for the first couple of years, keeping that residency requirement. Then you may want to keep your foreign insurance, because then you can call up your doctor and say, hey, I'm in town, my throat hurts, can you take me? Up to you. Also, network, network, network. I must say network as often as I say research, because one leads to the other. But why reinvent the wheel? Find out what other peers have done, not what your kids have done, because many of you may not be having babies or need pediatricians or traveling for the same reason, but find out what others have done. And yes, in our day and age, that comes through either an email chat list or Facebook or whatever kind of social media works for you, people who you know. Now, yes, I understand that there may be some of you who are actually coming to plant your own roots, whether you're single, whether you're married, it doesn't matter, but you're coming out of your own love of the country. Still do your research and network, and do the networking within your community of choice. Why should you have private insurance in addition to the Kupat Cholim system? It's a personal choice, whereas over 80% of the Israeli community has supplemental insurance, much less have private insurance. It costs more money, and it is age and pre-existing condition affected, meaning you may not be eligible. A person could be 20 and not be eligible based on a need. What does it get you? Private insurance gets you mostly coverage for a very serious need, such as a transplant abroad. Private insurance is not what's necessarily needed to pick your own surgeon, because you have that opportunity through the supplemental. It's important to research, and not everything can be researched all at once. What you want to research before you get here is how your personal needs will be managed. Perhaps you're coming with a need for medical cannabis, or perhaps you're coming with a need of dialysis 2 days after you get here, or you're in the midst of some sort of healthcare crisis, but now is when you have your window to be able to fly. How does that work for you? How does that work for your family members who are traveling with you? How does it work for the supports that you will need? And is now the right time to come? There's lots of stories from a post-Aliyah perspective that I could share with you, both for the positive or for the negative. The negative might be if you're coming without resource here. When I say resource, I mean support to turn to if you are truly in the midst of a medical situation. The positive, on the other hand, might be if you're joining family who can help ease your personal burden in dealing with your medical situation. You want to feel secure in terms of your medical needs, that you have chosen the right time to make Aliyah. What is the availability of the medication that you are taking? So if you're taking a statin of some sort, if you're taking a high blood pressure medication of some sort, if you're taking something that's typical, then yes, you can count on that being available in Israel. But you may be taking something that's typical with a twist, or you may be taking something that's a little bit more atypical, a thyroid medication, a diabetes medication. How can you find out if those medications are even available in Israel? You'll find on our website a link to a ma'agar. Someone help me with the English. With a
Database.
database, thank you. With a database of medications through the Ministry of Health. We have a link to that on our website, and you can type in English your medication and the milligram. Now, what if you are special and you don't take a pill, but rather you take an injection or a patch, or you take an off milligram? You don't take 50, you don't take 75, you take 61, right? Find out. It is not the place you want to be surprised. What about pharmaceutical imports? Somebody asked in the beginning, they are a vet and they want to be able to import. They're a veteran and they want to be able to import medication. One can never import anything that's cannabis based in any way. It's considered illegal. And I'm going to come back to medical cannabis in a second. But pharmaceutical imports are available. Vitamins are not a pharmaceutical import. Vitamins are not considered a medication, it's a supplement. And there are many of you who may take many supplements. And I would encourage you to look at the website called iHerb, IHERB.com. It's something that I discovered because of Corona and all my trips to the US stopped. And I found out that as long as I keep my orders under $75, I could import to my heart's content my supplements, my vitamins, anything that I needed, tax-free, meaning I paid no customs whatsoever. There's an article on our website about importing medication and how it needs to be imported and what form is necessary to do so. And when done right, it can really, really work for you. When it comes to medical cannabis, as I said, anything cannabis-based can never be brought into the country, including in your luggage on your Aliyah flight. Now, you may want to say, well, when I make Aliyah in December, I want to bring a year's worth of. So most people are not bringing a year's worth of. But whatever you do bring, I would encourage you, if you can, to bring 1 to 3 months of your medication, simply because you don't want to get here and have to start running around to find the doctor because you only have 2 pills left for whatever it is that you need. And this goes really for non-script medication as well. You don't want to get off the plane and have to find a place to go find Nurofen. You don't want to have to go find whatever aspirin that you need. If you have a need for medical cannabis, I encourage you to read carefully up on the article and know that it will be important for you to make alternate arrangements until you can get the cannabis in your hands, which doesn't have to be a long process, but it's not a today to tomorrow process either. Last thing to discuss, and I know that our time is running out, is mental health. We all have our mental health needs. The Kupot Cholim covers mental health, whether that's psychiatry, whether that's psychology, whether that's a social worker. You may or may not decide not to use you may or may not decide to use the Kupot Cholim system because there could be a waiting period, not because you're an Ole Chadash, but simply because it's a wait until somebody is going to open up and have time for you. You may not be able to find a native English speaker, and this is important to have a native English speaker when it comes to mental health. And therefore, you might choose to go privately. Privately can cost you anywhere from 250 shekel and above for a 45-minute session. Get Help Israel is a site that I'm mentioning specifically because they have a wonderful section on explaining how mental health works in Israel. Also, if you'd like, in another couple of weeks, we're going to be having a webinar on navigating the mental health system specifically. If you're going to go privately for mental health needs, keep in mind the financial considerations when building your budget and know where to turn prior to your arrival. And Aliyah can be a big trigger. It's stressful. It was stressful to get here, and it can be stressful to be here. Look for the help to help ease the transition. There's a lot of vocabulary when it comes to making Aliyah. A hafnaya, which is referral. A hitchayvut, which is an obligatory note that your Kupat Cholim has agreed to pay for your MRI at a certain hospital. All Kupot Cholim can be recognized at any hospital, although there are certain hospitals that are Kupat Cholim specific. So if you were having an emergency, you could go to any Kupat Cholim. If you are having a scheduled surgery, you may be directed to a specific hospital. Think about who you are and your needs. Do you need a disability tag, a handicap tag? Know how that's going to work in Israel. I don't want to just keep saying on our website. On our website, that's very impersonal. But your disability card for your car is not internationally based. We have a computerized system here in Israel. If you need to go to Maccabi in Tzfat, it's the same as going to Maccabi in Beit Shemesh, where your doctor will swipe your card and see what your last need was. The time spent with a doctor is different in Israel, 7 to 15 minutes, not an hour long. And it is very directed towards the need. If your throat is hurting, he may not palpitate your stomach because your throat is hurting. Know where to turn. Nobody wants to be stuck in an emergency situation. We are so happy to give you so much more information that's not really appropriate for a public forum, but so much more on a one-on-one basis. Think about having a durable power of attorney, a living will, and what that means. Who's going to make medical decisions for you if you are incapacitated? And know that when things are different, they're not wrong, they're just different. And it does take time. Even if you are saying to yourself, we've been in Israel 4 times a year until Corona, we're really comfortable. We've always gone to Wolfson for our medical care. Wolfson is in Jerusalem. Know that once you make Aliyah, you cannot use Wolfson as your medical center. They do not take new Ole Chadash patients, even if you have gone there for the past 30 years. Think and plan and research. And you may need to reset, and you may need to say, wow, that's not going to work for me, even though I thought it would. So what is my plan B? It's important to have a plan B on every important aspect of your Aliyah. It helps you be prepared. And our last slide, Sarah, is call us. We're really happy to help. You may not get an answer within 5 minutes. Sarah and I both literally get over 100 emails daily, but we make time for everyone. And we are here for you to answer these very important questions. We're sorry that we cannot take any other questions in the Q&A. We're about to be kicked off because there's another webinar coming up. Be in touch. And I wish everyone a fantastic day.
Have a great day, everybody. Thank you for coming.